da, good morning. I'm really pleased to be able to join you today at this inaugural Arts and Health Conference in Wales, and it's fantastic to see such a powerful showcase of the innovative arts sector we have here in Wales. We should all be very proud of the collaborative working you display and the partnerships working together in the network. Good mental well-being is as critical as good physical health and well-being. Person-to-person interaction, engagement in our communities, and a sense of value, purpose and meaning need to be seen as equally important as healthy eating and physical exercise. There is a strong and growing evidence base for the impact of arts on health and mental health. It is really great to see you all working together to tackle the most pressing mental health issues facing the people of Wales. Arts and creativity are important human occupations. Creativity is a powerful and enriching element of people's lives. The Mental Health Foundation identifies that the arts have an important role to play in offering help, promoting well-being and creating a space for social connection and a sense of autonomy. The Wellbeing of Future Generations Act and A Healthier Wales make clear our intention to improve the health and well-being of the people of Wales, prevent ill health and support people to manage their own health and well-being more effectively. As part of our Together for Mental Health delivery plan, we outline our priority for services to be responsive to individual needs and use a recovery-based approach. We will be keen to build on this as we develop our successor strategy to Together for Mental Health, which we are working on at the moment. We've engaged widely with our stakeholders and will begin a formal consultation to inform the final strategy by the end of the year. Last November, the Strategic Mental Health Workforce Plan was launched following a comprehensive engagement process. The plan seeks to build a sustainable and diverse mental health workforce across both health and social care and to improve access and outcomes. We have formalised the strategic programme for mental health and appointed a new National Programme Director. This programme will focus on quality and improvement, the reduction of variation, and will work in partnership with the Mental Health Workforce Strategy Implementation Group. There is also good integration with the mental wellbeing work stream of the strategic programme for primary care. However, formal services are only one element of supporting people. We need to join up our community support, early intervention services, local primary care mental health services, as well as our specialist service provision. This will lead to high quality, safe and effective pathways and reduce the impacts of health inequalities. Many people already access the excellent resources in our communities or can turn to their friends and family for help and advice. Another important option is using social prescribing to connect people with their community to better manage their health and well-being. In 2022, we consulted on the development of a national framework for social prescribing, and we will publish that later this year. In June, I was pleased to announce the national rollout of the NHS 111 Press 2 for urgent mental health. This provides direct access to a mental health professional 24 hours a day, 7 days a week. The Wales Arts, Health and Wellbeing Network reflects the wide range of options needed to keep our population well. These range from involvement in general creative activities, organised community participation, and specific actions intended to improve people's well-being and social interaction. There is, of course, also the formal use of arts and creative media as a basis for highly specialist treatments by art, music, dance, and drama therapy professionals. The Allied Health Professionals Framework, Looking Forward Together, sets out the actions required to ensure that the skills of arts therapists are used to the best effect to improve health outcomes and deliver our policy objectives. At the moment, allied health professionals cannot always be accessed early enough. In the future, the AHP workforce will provide more care closer to people's homes to ensure the highest value, quality and outcomes. In April this year, the Minister for Health and Social Services announced an additional recurrent investment of £5 million in order to help achieve this and build greater preventative and rehabilitative services for people closer to home. I hope this has outlined to you how seriously we take the need for a vibrant arts and health sector as part of our approach to improving the health and well-being of our population. There is an abundance of innovation and transformation across Wales, and today's conference is a clear indicator of the quality and creativity you are bringing to this vital work. I want to thank you for inviting me today, and I'm sure that you will have a productive and really inspiring conference. Diolch yn fawr.